We will now hold a public comment period. Those in the room who wish to make a comment based on the day's presentations or comments relevant to the committee's statement of task are invited to do so now. You'll see the microphones, whatever they're called, at both sides of the room. And please make your way up to the microphones, or if you're unable, raise your hand and a staff member will bring a microphone to you. No one signed up to make comments, so we're not going to take them first because there isn't anybody. But if anyone is attending the meeting virtually who wishes to make a comment, send your comments electronically to stiprevention@nas.edu. That's stiprevention, all one word, at nas.edu, and staff will read them aloud. Please keep your comments pithy, and you may also submit additional materials to the committee after the meeting as well. In fact, we would welcome such materials. Seeing no one at the mic, we'll wait just 60 seconds to see if anyone sends an email in. Yes, thank you.
Good afternoon, and all the sessions have been very informative, and we plan to share. But I have one as a parent.
I know you're from HRSA, so tell
I
us
didn't say
your
my
name.
I'm sorry, I'm Sonia Hunt Gray, and I work for HRSA and the HIV/AIDS Bureau as a branch chief for the West. And so my question as a parent, when you're talking about the app and all of that, I never saw a disclaimer for parental consent. So can the children just get on, 13 to 15, they can just get on?
13 and older, yes, according to NASEM regulations, yes.
Okay.
Yeah, a broadening of that question, though, is how might you have, and you might want to come back to the mic, how might you have, the work you did with ministers and with parents and with teachers and principals and political leaders. There was a lot of background work. Maybe you could just make a comment.
Yeah, so in our inspiration and in our ideation phases, we engage with a lot of stakeholders, especially adults with decision-making power. So we know that some parents lock their phones or have parental controls. We also know that some schools don't allow phones or don't allow schools to have phones during classroom instruction. So we knew that there were many potential barriers, and so invited a lot of parents, sought out those extremes, brought them into a room and asked them lots of questions. And across the 3 sites that we were working in, so New Haven, out in Gaston, North Carolina, and then El Paso, Texas, we did not actually have any parents come up to us and tell us that they were hesitant about this, especially after we explained to them what the app was going to do. And so I think that many parents were relieved because they were not the ones that needed to be sharing this information. And so I think that we had a lot of concern that we would face a lot of negative barriers from adults, but that was not what we found, and we spent a lot of time with adults.
Okay. Well, just a follow-up question to that was the fact that, I mean, you said according to Apple and their requirements, but did you just make it an open information that ages 13 to 15, you said this, but you didn't say you do or do not have to have parental consent. And so I was just thinking that that disclaimer should be there somewhere, because I know with my daughter, what I did, we had a contract with the school, we had a contract, and with Snapchat and all those kind of things, and then, you know, we said how much time, what you could do and that sort of thing, but with this, it's just sort of like they're off to the races and they can do this, which is good information and they need it, and the school needs to be, you know, to do it in the first place. But can you maybe say, so that the parents don't think it's something else, that they know that they're doing this as you go further, because I'm sure you're going to go, the trajectory is just far with what you guys were talking about. So I'm just saying, just so that parents are comfortable with what you're doing.
Yeah, interestingly enough, though, the overwhelming majority of our teens could download the app without, like, their parent wasn't the one that was looking at their phone. And so I think that that would actually be a burden to students to then have to present it to their parent to get some sort of parental permission. So we did think about it, but because we are, our intended users are the teens, and they're not using it in schools. They're using it whenever they choose. That was not what came out of the design process.
While we've got you there, I actually have a question for you. So
Seth
I'm Seth
Kalichman from
I
University.
looked at the, okay, I'll admit it, I downloaded the app. So it's in entertainment.
Yes.
So I really would like to hear you talk about it, because I was like, well, it's not education, it's not health, and that's smart. So that was like very intentional.
Yes. And so
Could
after.
you talk about the?
Yeah, so again, after the co-creation sessions with young people, and then knowing the research that young people spend mere seconds browsing through the App Store to decide whether they want to download it, and then after they've downloaded it, again, another set of a couple seconds to figure out if they want to actually keep it on their phone or just immediately delete it, we realized that the App Store description was really important. And so we tested mock versions of the App Store descriptions. Some of them were labeled as health, education, lifestyle, entertainment, and we found that teens really liked it when it was entertainment because health and education have the stigma of they should be doing something better, and they really wanted something that in their minds were really for fun. We knew that there was end goals and outcomes that we wanted to achieve, but again, with the need, the want for real teens to actually use our app, we very intentionally made that decision.
Seeing no other public comment, I want to thank all of you who've spoken today and are still here. I know I speak for the entire committee to say we're very eager to continue our work built on the building blocks that you've given us today. We are going to reconvene in closed session in 6 minutes. So when the big hand hits the 7, and I kindly ask that our meeting attendees and speakers move any post-meeting discussions outside this room or the cafeteria on the 3rd floor. So the committee members come back right here in 6 minutes. If you have any, the rest you don't have to listen to, but I have to say it. If you have any comments or questions, please send them to Amy Geller, to my right, the study director at stiprevention@nas.edu. Please keep in mind that any material you wish to share with the committee will be made public through the project's public access file, which must be done because the National Academies comply with Section 15 of the Federal Advisory Committee Act. Also, to remind you that all the slides from today will be up on our website within 1 to 2 weeks. Thank you all again. This meeting is now adjourned.